My name is Ashok Modha. I'm a neurosurgeon at Rebound Orthopedics and Neurosurgery. My subspecialty in neurosurgery is brain and spinal cord tumor surgery. I was born in Kenya, in Nairobi. I then moved to Canada, where I did all my university education and medical school and neurosurgery education. I then came to the United States for some more training in New York City, and then I moved here to Portland. I've been working for more than 20 years. My hobbies, besides working, include running and cycling, as well as hiking and camping and enjoying the great outdoors of the Pacific Northwest. I like to travel as well, and I like to read, and I like photography. My early education was in Kenya, where I did elementary school and high school. After that, I moved to Canada, to the city of Winnipeg, and I did my undergrad and medical degrees there at the universities of Winnipeg and Manitoba. For my residency, I went to the University of Ottawa. Ottawa is a capital city of Canada and is located in the province of Ontario. There I was exposed to a number of neurosurgeons who taught me a lot about brain surgery, spinal surgery, tumor surgery, and I became quite interested in brain tumor surgery during my residency. Because of that, I decided to go for some extra training in brain tumor surgery. Ended up going to New York City to the Memorial Sloan Kettering Cancer Center, which is one of the biggest cancer hospitals in the world. And since it has a large number of patients who come there for brain tumor surgery, I thought it would be a good place for me to go for extra training. For the year that I was there, I was exposed to all sorts of different types of brain tumors and different types of brain surgeries, and that really helped me gain more experience. After that, I moved here to Portland and Vancouver, and I've been living here for about 20 years and working here in the same job. Do a lot of brain tumor surgery and some spinal cord tumor surgery. And then, of course, I also do other types of neurosurgery, surgery for disc herniations and spinal stenosis. I also do surgery for brain trauma and spinal cord trauma, as well as surgery for bleeding in the brain or stroke in the brain. At Rebound, we have 7 neurosurgeons, and each of us subspecialize. So when a patient is referred to our clinic, if they have a unique problem or an unusual problem, they're scheduled to see the neurosurgeon who specializes in that. You would then get the best care possible from the person who is most experienced in your condition. So, for instance, if you had a complicated brain tumor, you would be scheduled to see me. If you had an aneurysm problem, you'd be scheduled to see the surgeon who specializes in that, and so forth. All of us also tend to help each other out. So if a patient presents with a complicated problem that could require all sorts of different options of treatment, we often confer with each other and try to get the consensus in terms of treating the patient and then counsel the patient about that. That very rarely happens in other neurosurgical practices. The other thing that we are also very good about is referring patients to each other. So if I see a patient who has a problem that I can't treat adequately, I have them see one of my partners who I think would do a better job or would be able to help them out. The reason why I like to be in this field and do what I do is because I can make a profound impact in patients' lives. There are times when I can help patients have a normal, healthy life, but after I treat them. There are also times when patients come to the hospital with a spinal cord injury or some other major neurological problem, and after we have treated them, they're able to go back home, they're able to walk and talk and take care of themselves again. This is, of course, very rewarding